Welcome to Talking Heads on USA Global TV, starring the one and only wonderful Dr. JACALYN. It's a prestigious place where world-class influencers and experts meet, and where you'll find the most trusted advisors and coaches for all things in life and business. Visit usaglobaltv.com to sign up for our newsletter, get the value you need, and be first in line to learn about events and giveaways and other valuable content. Connect with us. Email Dr. JACALYN at usaglobaltv.com to talk about how you can become part of USA Global TV. That's USA Global TV, where the doctor is always in.
Hello, everyone. Welcome to USA Global TV and Radio. It's so nice to have you here today. I'm Dr. JACALYN KERBECK, and our show is Authentic Achievements. And of course, in the world of live TV and radio, things always happen. My co-host is Without Power, and our guest, I'm really looking forward to meeting him. He is not here yet. So I'm going to play some sponsorships, and when the doctor is in, Dr. Robert Yoho, we will come back on and have an interview with him. So thanks for your patience and understanding. He's on the West Coast, so it's pretty early there. Okay, we'll be right back. Thank you. Hello, everyone, and welcome back to USA Global TV and Radio. I'm Dr. JACALYN KERBECK, and our show today is Authentic Achievements. My co-host, KIM-ADELE Randall, is out today. She has the day off, and we have a super fabulous guest. I have to tell you, I already went and purchased his book. It's coming tomorrow. I signed up for his newsletters. I signed up to be able to hear all of his podcasts. He is amazing what he has done. His name is Dr. Robert Yoho. Please go over to his website, which is robertyohoauthor.com. I have posted that in the comments. He's written a book that is amazing. As I mentioned, I ordered it. I urge you to do the same. The book title is Butchered by Healthcare: What to Do About Doctors, Big Pharma, and Corrupt Government Ruining Your Health and Medical Care. Let's welcome him to the show. Hello, doctor.
Thank you so much, JACALYN. It's a pleasure to be here.
It's so nice to have you here, and thank you for joining. I know it's super early there on the West Coast, and just appreciate it. So, doctor, as I mentioned in the beginning of the show, I'm really excited to have you here today. I have always been fascinated by the world of plastic surgery. I have been getting Botox and fillers for 20 some years. And anyway, it always seems like you're going to be so much better looking and more confident and you have more friends, but it's really not the truth, correct?
No, I think it is the truth. It's an arms race out there. Yeah, it's an arms race out there, and looking good is very important. But I'm retired from that. And the first thing I want to say is, if it's okay with you, we're colleagues here. Let's go on a first name basis, JACALYN. Robert.
Fantastic. Well, thank you, Robert. I appreciate it. So your career is that's a gold star, one after another. You started out as a yes, that's the way I'm looking at it. So you started off as a physician in the emergency room. Is that correct?
That's correct. I had a lot of training, and I was an Eagle Scout once too, but I'm not sure how relevant that is to this conversation. And it has seemed like a huge struggle to me. And it doesn't seem like it, but I've got a 20-page resume. So I guess that means something, right? You can if you're 68, you can put a lot of things on your resume.
Well, you've actually accomplished so much in your life. And I just want our audience to realize that we interview a lot of authors on this platform. We have 20 shows a week. So what you've accomplished is really, it needs to be shared with our audience. So you had this illustrious career as a surgeon, and you decided to walk away from it, I believe, in 2019.
Well, I was 65, and that's the average age of retirement. And, you know, had been working for 2 years on my books about corruption. And I got started. Well, let me do the 10-second disclaimer first. This isn't medical care. Use this information at your own risk. You know, we have to do this because of the lawyers. And if you have a medical problem, go see a physician or other provider. And, you know, so sorry about this disclaimer, but my career, essentially the last 10 years of my career, I prescribed hormones for women because my patients were mostly women. I mean, 95% of the cosmetic surgery is done on women. And as I matured, right, the nice word for aging, I became aware that my patients were miserable. I mean, most of them were over 50 and were suffering with hot flashes, intellectual decline, and you know, a lot of agitation, depression, and anxiety. And I learned about prescribing bioidentical hormones, and eventually wrote my book about it, Hormone Secrets. And that image on the cover is a Mexican mask I found in a Houston restaurant. And here's me standing by the mask. And I had superimposed on the mask, I had superimposed on the mask the names of the hormones. And that's what our brain is like on hormones. It's not just men, it's not just women, it's men as well. So I started prescribing these things, and I learned that the FDA had put these black box warnings on the hormones, but we had more experience of these drugs than any other drugs in history. We have been using thyroid since the 1800s, and progesterone, estrogen, and testosterone for 40, 50, 60 years. And even growth hormone, we have 50 years of experience with. So there was something fishy, and I started looking into it, and I found that there were fake studies, and this whole thing with the FDA was completely fake. And later on, I discovered that the FDA gets 50% of its budget from big pharma in the form of user fees incurred during the patent application process. So they're entirely a marketing arm of big pharma. And essentially, these hormones would replace many other drugs that are very profitable, such as statin anti-cholesterol drugs. It would improve the health of our whole population. But big pharma is not all about that. They are about selling medications chronically over and over and over again. So as I got into the hormones, I became fascinated with medical corruption. And it led to a 3-year quest where at the end of it, I published my book, Butchered by Healthcare, which you referred to. And this is a very inflammatory cover and an inflammatory title, but the whole thing is well deserved by the healthcare industry, because we spend twice what any other country spends per person on healthcare. We spend 20% of our gross domestic product. England, Canada, Australia, and so on, they spend about 10. These are the advanced countries. And even Singapore, which gets fabulous health care, they've managed to get it down to about 4.5% of their gross domestic product. So it's an outrage, especially in view of the fact that our health is worse than any of the top 40 countries. I mean, by measures such as longevity, it's terrible. So I just got further and further into it, and we can get into details about what a mess healthcare is if you want to get into that book.
Doctor, there are probably 50 subjects I'd like to discuss with you based on what you just shared. The first I just want to touch on is hormones. So I'm 59 and I'm in the middle of menopause, right? Nobody tells you that all these things are going to happen. But I just had a conversation yesterday with a friend who now is having something injected into her glutes for, I don't know, some type of hormone, and other people taking all these pills and whatnot. I mean, is there anything that is there any validity to doing any of these things, or should we just sweat it out?
Good. I like that. Sweat it out. You don't want to sweat it out. You need to get started on hormones. They're almost universally good. If you go and look them up online, you're going to find these black box warnings, and where the claims are going to be that, I mean, even for testosterone, which is really a super safe drug, it's been turned into a scheduled drug, which means they have controls over it. And I mean, the claims are that it causes heart disease and blood clots and cancer, right? And it's all nonsense. Now, there are caveats. This is not something you do by yourself, but they're almost an unalloyed good. And there are many approaches. And what I recommend for the listeners, because it's very hard to get a straight story from any doctor. But if you read Hormone Secrets, I put everything I knew about hormones in this book. It's like a little textbook written down to the 9th grade level. And I'm not being condescending, but I took great care to make it not so complicated for, the layman audience. And you can, once you understand this material, you can push your physicians to do the right thing for you. And women can do something as simple. There are injections, there are pills, and it's a little complex to figure it out. But you can do something as simple as getting a testosterone pellet every 3 months, put into your fat somewhere, and that dissolves, and the testosterone dissolves and changes into estrogen in a certain part of it, and that supplies. I think doing that alone, without even using estrogen and progesterone and the other hormones, that would supply over half, maybe 75% of your symptom relief. But there's a whole host of things to learn about, including even something as simple as vitamin D, which is over the counter, which virtually everyone should be on, except for lifeguards living in Florida, because we don't get enough vitamin D. And it extends life. It protects against coronavirus. It decreases your chances of getting many chronic diseases. And we have a study with 250,000 people in Scandinavia where we check their vitamin D levels and check their disease problems, and it correlated. Now, that's called an observational study, so that's not absolute proof that giving vitamin D would improve your health, but it's extremely suggestive. And there, the data about vitamin D is huge, and the stuff is cheap. So that's one quick red pill that your audience can implement for themselves. The dose is typically 500 or 5,000 international units if you're under 200 pounds, and 10,000 if you're over. But you can check your levels. And again, we don't give specific medical advice, so check with your doctor. That's what we're always supposed to say.
Thank you. I spend a lot of my time behind this green screen in the dark, so I started taking vitamin D because I thought it can't be very healthy to be in the dark.
You can get a level at lifeextension.com without a doctor's help. And this is one where I think you should, if you can't convince your doctor to draw your level for and get your health insurance to pay for it. And we want levels up around 100. This is not conventional, but this is what makes for the best health, according to the studies.
Thank you for sharing that. And you mentioned a little while ago about our healthcare system, and I just want to let you know, and our audience, that we have a global audience. So we're talking specifically about here in the United States. Something that I found to be really fascinating. I retired from my corporate career in 2020, and then I went out and started doing this. And so I always had the best insurance, and I never thought twice about what it was going to cost for prescription, going to the doctor. Will go out on my own, and I'm literally speechless that the same medication that I was paying $10 for is $1,200 a month. Then it's $600 a month. It's like you go to Vegas. It could be it's fascinating. So can you share with our audience, and I know based on what I read on your website that you didn't have direct interaction with the pharmaceutical companies, but can you share how does all of that work, that the same bottle of pills is a different price for different people?
It's a racket. And the pharmaceutical companies are the most criminal industry in history as measured by their settlements with federal prosecutors. They're I don't want to get this wrong, but I think they're at $87 billion in settlements and judgments since 2000. I mean, it's just stunning. So these guys, they work together to fake their drug patent studies with the cooperation of their entirely lapdog, bought off sock puppet FDA. And I mean, I'll quote Peter Gercha, who's one of the founders of Cochrane Reviews. He said the pervasive scientific misconduct has led to a research literature where one has to dig deeply to find the few gems among all the garbage. And there was a title of a British Medical Journal editorial from July 2021, "Time to Assume that Healthcare Research is Fraudulent Until Proven Otherwise." Right? And I mean, it goes deeper and deeper. The medical journals are prostitutes. Their editors are paid hundreds of thousands of dollars each year directly by the medical industry. Corporate ghostwriters fabricate over half of their drug studies and even some textbooks. And the authors are paid huge fees for just putting their names on the publications. If this was law, business, or government, bribes like these could result in firing or criminal prosecution. But it's accepted practice in healthcare, and all they have to do is disclose the, quote, conflicts of interest, which should be branded as bribes. So it's a mess, and the only thing anyone is interested in is recurrent revenue and the huge money that is all dragged out of our system through government payments and Medicare and insurance payments. The insurance industry is another big part of it. They take 20% off the top of the entire $4 trillion in U.S. healthcare. I mean, just think about that. And no other country does it like we do. It's done like it's administered by these insurance companies who have nothing to do with healthcare. I mean, they shouldn't be involved. It's administered by these guys. And it's just they're arguably incentivized to increase the total revenues, because they're like the Vegas house. If the grosses are bigger, they get more money.
And doctor, how does it impact the physician so we know how it impacts the patient, right? But the patient's constantly trying to go to Google or talk to this person or that person to figure out what is it I need to do to get the healthcare treatment that I need or get a second opinion or third opinion. But how does it actually affect the physician if you are sort of an arm's length away from the pharmaceutical companies and the insurance companies?
That's a two-part question. You said go to Google. And Google is the least reliable imaginable source now because it's entirely captured by the corporate sources. And even Wikipedia is under constant attack from ghostwriters from every possible narrative. The pharmaceutical companies just constantly rewrite Wikipedia, and you can't keep up with them because they've got paid ghostwriters. But the question is, how does it affect physicians? And physicians are largely idealistic, but they have been captured too. And ever since the Affordable Health Care Act, commonly known as Obamacare, the number of independent physicians has dropped to nearly zero. And so these guys, they're harried, they're busy. And the worst thing that's happened to physicians is with Obamacare, they now have to do their medical records on a computer. And this sounds very sensible. It sounds like it would save time, be more accurate and everything else. But you're not going to believe this story, but their time is now about 40% clicking on computers. Just think about that. 40%. They have to go home at night, and in order to get paid, screw around with entering codes or clicking boxes. And so it's just they are too busy to even read the medical literature. And there are a few polymaths who can do it, but for the most part, they are just running in circles trying to keep up with their and the ones that are they're involved sometimes in management, they have to keep up with everything, and they have to somehow get paid, and then they have to do the hardest thing of all, which is deal with all the patients. And it's a mixture of sales and academia and authority, and it's an impossible job now. It was difficult when I did it. And I never got involved with computer billing or or had anything to do with insurance companies, basically in the last 30 years of my life, of my career, because, I was cash pay. And of course, I had conflicts too, because in theory, my conflict was if I could convince them to do some procedure, then I get paid more. So.
Thank you for your transparency about that. A question I have, and I've been told this over and over again by people, their prescription is coming up for renewal and they call the doctor's office and they get you haven't been in to see us. We're not going to refill it unless you come in. Is that legitimate, or is that just a way of making money?
Well, both. Okay. So something interesting happened during Trump's last year in office. And he said that anyone could see a doctor for any reason, even on a first visit, without coming in. And you could do it virtually. And if the person didn't have a connection so they could see the person, like Skype or whatever, they could do it over the phone. And prior to this, it had been a pretty firm rule by the state medical boards that you have to see someone in person, at least for the first visit, and then possibly the medical boards could get after you if you didn't do a good faith face-to-face visit once a year. There was a rationale for it. It made sense because an experienced physician can sometimes just eyeball a person and tell what's going on. I mean, you've got all the body cues and the interpersonal distance and all that stuff, and you can sometimes make diagnoses and tell what's happening in a glance. But this thing was thought to be reasonable for COVID, and in fact, it has proved to be a great boon for those of us who have chronic diseases that are unusual. So you can go to Stanford, Yale, Harvard, or wherever, consult with the best of the best, and pay them a few hundred to a few $1,000s and get the top medical care in the country now. And in fact, what you can do is you can shoehorn your local doctor into doing exactly what the best think that is needed. And because the drugs, of course, are available universally in the United States. So this has been a great boon. The other thing that's happened that's helped patients is we have these patient groups, right? And these things are largely sponsored by pharmaceutical companies, but there are still tremendously idealistic patients and family members who have studied these diseases exhaustively and can give you help and sometimes even tell you exactly what's happening and what to do informally in these groups. And you can communicate online with them. So anyone that has internet connection can get into these things. And smartpatients.com, I think it's smartpatients.com is a good entry into this, but you can search for patient disease groups or patient disease groups, muscular sclerosis or whatever your problem is, your exotic cancer.
Thank you, doctor. I have a question that is relates to a personal experience, and then I want to turn to reality TV, plastic surgery, and everything that can go right or wrong. But my question is, I have facial eczema, and I was prescribed Dupixent by my dermatologist, who is a Penn. So I left New Jersey and I'm now in Florida. So when I moved to Florida temporarily, I'll go back to New Jersey. I called about the Dupixent. I was told, well, if you can't come in, then we can't give you a refill. Well, I know I can't come in because you're there and I'm over here. So I had to start the whole process again with a new doctor. And long and short of it was going to be $4,000 a year. And then I had to talk to the drug company, the manufacturer, their loyalty program. I couldn't believe it was just kind of like the shell game where they keep moving the things around. And finally, after about 7 weeks, it was approved. And I thought, if I didn't have the due diligence to make phone call after phone call and keep pushing, I wouldn't have gotten this. And then I said to myself, I'm going to find natural, holistic ways to overcome this. So I did the first injection and then I didn't do it again. So my point is, why did they make it so difficult?
Yeah, I can tell you that. I can tell you the answer to that.
Okay.
I mean, look, I'm laughing, but this is definitely black humor. It's horrible what's going on. And there's an obvious answer, and it's follow the money, right? So every injectable that's delivered in a doctor's office, the doctor gets 20% of the total costs of the drug off the top. And this has destroyed oncology. oncology or cancer therapy is now the ambition of every oncologist is to get a room filled with Barca loungers, recliners, with dozens of patients getting their chemo drips every day. And they have enormous salaries because they get 20% of all the costs. And these drugs cost hundreds of thousands of dollars a year in some cases. So that's the answer to your riddle. I mean, it's just it was a conflict of interest that was not revealed to you. And I can tell you that these new drugs, I don't want to say that there aren't miracles to be had. Some of the new drugs are absolutely great, but eczema is something that can be handled by any dermatologist effectively, usually without this horribly expensive kind of therapy. And that's a perfect example of the outrage. Now, this insurance company, they're in the position, they've got all these greedy monsters around them who are, we have this sick blend of capitalism and socialism in our healthcare system. And all these people, and I'm talking about the doctors and the physical therapists and every other provider imaginable, and the pharma companies are trying to whip the revenues out of the insurance company. And the insurance companies they don't have a wonderful incentive to control costs, but they can't give away the whole pie every year. I mean, when the pie gets bigger, they don't mind giving away the money. But if they give it away to the pharma companies, who essentially there's no cap on these drug costs, and they charge whatever they possibly can think of that might be paid. So this drug is like what Warren Buffett said about cigarettes. They cost a penny to make and sell for $1. I mean, it's just absolutely crazy. And the companies claim that their development costs, their research, is a huge percentage of their budget, but it's actually much smaller than their promotional costs. And they do direct to consumer advertising, where there's only 2 countries in the world that do that: the United States and New Zealand. And it's an outrage. Everyone in the room knows how crazy it is, because the patients can't evaluate the drugs, the doctors can barely evaluate the drugs, but when you push the medication to the patients, they're incentivized to go into the doctor's office and said Pfizer told me this. I mean, it's awful. And I'm laughing because it's so dark.
It's fascinating. Another question I have for you, I'm on the board of the Crohn's Colitis Foundation, and I run a support group, and I hear the same thing over and over again from patients, and I'm also a patient. I was on Remicade for 2 years. It doesn't work anymore. They put me on Humira. I was on Humira. It's not working anymore. What is that? The drug stops working? Is that 2 years and you have to switch to something else?
Okay. Now there's some, again, this isn't medical therapy for you individually, but
Right.
the carnivore diets have been very successful in treating Crohn's and ulcerative colitis. And I recommend that you watch Michaela Peterson's, she's got a 15-minute video, and I can find it and stick it in the show notes. But Michaela Peterson had juvenile rheumatoid arthritis, and she, which is an autoimmune disease like those other 2 diseases you mentioned. And she was just about ready to get her, she had joint replacements on her lower extremities and could hardly walk. And this is the daughter of Jordan Peterson, who's very well known. And this young woman is remarkable. She does these interviews, and she's a very intelligent interviewer. But her story is that the whole thing went away when she got on a carnivore diet. There are also many anecdotes about people with your problems, basically the inflammation going away and the whole thing. And a carnivore diet, what that means is you just pretty much eat beef and eggs and cheese, and that's almost it. So it's not that easy a thing to get started on, but once you get started on it, it can be very helpful. And I know people that were on the point of getting their colons cut out, which is the treatment for ulcerative colitis. You don't have any more problems if you don't have any more colon, right? They were on the point of this, and they cured the thing, or at least put it in total remission with the carnivore diet. And there's if you just search for carnivore diet podcasts, you can listen to a lot of stuff about that and go on and on and on. And I have a podcast about a summary podcast about the different diets on robertyoho.substack.com. It's about 10 episodes back, and I interview a family practitioner who himself interviewed all these diet people, and the carnivore / keto diets are gaining a great deal of credibility to improve health. So anyway, that's I lost track of your original question when I started going into, so remind me again and I can tell you a little bit more.
So thank you for sharing that. My question was in reference to the feedback that I get from people attending support group meetings. They're all on different biologics, or some maybe prednisone, and what they're finding is that the drugs only last for so long, and then they're given high doses of prednisone and they're told to switch to another biologic. So the question always comes up, are these drugs genetic, or are they designed to only last for a certain amount of time, then you have to move to another one?
Well, so a two-part question again. First of all, prednisone is a tremendously problematic drug. It's an anti-inflammatory, and if you take it chronically for long periods of time, your bones deteriorate. I mean, you just fall apart completely. But it's necessary for some of these autoimmune diseases. And it's not a first choice by any means. So, but it's used in combination for some of these regimens. Now, your question about the biologics is, are they designed to fail? And, with everything I've seen as I've studied this stuff for 4 years, I might be suspicious that that's the case, but you hate to impute motives where you can't prove it. And I don't want to say that these things aren't miracles. In some cases, they are genuine miracles and they're very helpful, but the price of these things is outrageous. There are, in many cases, alternative or traditional therapies that work very well. I mean, my family had an experience where, we tried to treat a fungal disease for, literally 2 decades. And then we found an old treatment that was found over the counter in a pharmacy in a third world country that completely got rid of it. And I had done a year of dermatology training in my early training, and I remember the stuff, and it was talked about back then. I'm 68. That was when I was in my 20s, so it was a long time ago. But now this stuff has been thrust aside by all kinds of the most expensive possible treatments. So anyway.
There's so much to talk about. I want to move into a discussion about plastic surgery. And there are some reality TV shows that I'm not going to mention their names, but when I've watched these, I've been fascinated, shocked, and horrified all at the same time at some of these botched procedures that you would not otherwise know about. Is this something that is commonly occurring that we're not aware of when you go under the knife for plastic surgery?
Oh, okay. So you're actually watching marketing for trade groups, right? And the trade groups point at the other guys and claim that they have all the complications, right? And so a great deal of judgment has to go on in this conflict of interest ridden environment that is the patient-doctor relationship in plastic surgery. And doctors are a spectrum. Some of them are only interested in taking the most money out of the patient that's possible. But there are excellent doctors, and there are excellent plastic surgeons, and there are excellent cosmetic surgeons. And so the two trade groups that you can be aware of is the plastic versus the cosmetic surgeons. The plastics have claimed cosmetic surgery for themselves, claim that they're the only ones that can do it, and love to point out complications of botches or whatever you call them of the other groups. And if you listen carefully to what they're saying, they're running down their competitors. But the truth is that cosmetic surgery, any surgery, has a finite complication rate. It even has a finite death rate. And so if you go into these things, you have to realize that you're taking a small risk. Even hip replacement, which is was voted the most successful surgery of the 20th century because it works so well. It's got an infection rate. It's very small. But generally speaking, cosmetic plastic surgeries have a tiny complication rate, and the fatality rate is probably 1 in 20 to 30,000, which is very small. The studies have been as high as 1 in 5,000 for tummy tucks, which is a much more invasive procedure where you hoover up the fat on the front of the abdomen and you go in and you stitch down the muscle wall and do all this stuff. It's a fairly complicated and lengthy thing. But for liposuction, it's probably 1 in 60 or 80,000 is very low. And I actually wrote a paper regarding the fatalities of cosmetic surgery and compared them to things like skydiving or other common risks. And that's on my original website, which is dryoho.com, dryoho.com, which is still up. There's a patch on the front of it that says I've been retired since around 3 years ago.
Doctor, again, thank you for sharing all this really fascinating information. What about the fact that we can now get injectables while we get a pedicure or we get a manicure? Are you going to the dentist? Would you like Botox while you're here?
Well, in some states, and this is a trade war, incidentally. It is no great trick to inject Botox or inject fillers. And dentists they probably inject 100 times what any physician injects because they inject all that local anesthetic. And it's a learning curve. And it's a trade war, and the doctors hate the idea that dentists can do anything. But I think if you have a manicurist who's injecting something into your body, you're taking a risk, and the safety and the repetitive nature of the injections is related to the fact that almost everything that is injected dissolves within a few months. So these women with these fantastical lips that have the WTF factor, really. I mean, they think men are looking at them, but they're really looking at them and thinking, what is that? That's what I think. But anyway, that stuff generally goes away. Now, we have silicone injectable that can be done off label, right? There's approved silicone for eyeball injections of various things. So that can be injected, but there's a small risk. And if that stuff gets infected, it's a lifetime nightmare and it has to be cut out surgically. So you can imagine having to cut all around the lip in order to squeeze out all the silicone in the lip. So anyway, I kind of got away from your original question. What was it again?
That's okay. I just was bringing up the fact that at least here in the States, in New Jersey, New York, places, Florida, that you can get these injectables at other places than going to a plastic surgeon or cosmetic surgeon. You can go to the dentist or you can go to your manicurist and they have somebody doing Botox. I'm not getting it done there, but
there are many states where registered nurses are permitted to inject. And again, it's just a learning curve. It's not that long a learning curve. And with proper training, you can get your gardener to inject your lips, right? But it's illegal, of course. But the nurses in California, for example, and I don't even think you have to be a nurse practitioner, which is a higher level of training to do these injections. I believe you can look that up very easily, but I think a regular RN, but they have to be supervised at least remotely by a licensed physician. So that's the answer. And if you've got your manicurist injecting you, I think you may be going to the wrong place.
Not me. No, I don't do that. But so going one step further, you mentioned about the lips and the women walk around with them and they think they look great and everyone else is thinking, hello, have you looked in the mirror? But does a surgeon have a certain responsibility to say no? For example, someone comes in, they're already really busty and they want to be they're like this, and yet the procedure takes place. What is the line there to say, no, I'm not going to do this?
Oh my God. Well, that's a great question. That's a great question. And, it's hard to divorce anyone from their pocketbook. And to say that a surgeon has superior abilities or a doctor has superior abilities to not think about his conflict of interest, or her conflict of interest when they're getting paid per piecework. And this is one of the major problems in healthcare today is pay, even for an office visit, there are incentives to bring the person back. And of course, if you're getting paid for the drug that you're administering in the office, like the one you mentioned, that's a horrible conflict of interest, and it's outrageous that they don't disclose that at a minimum. I mean, basically, it shouldn't be done that way. Somehow, pharma has been given a pass. Now, if you and I were physicians, and I develop a drug, and I say, look, sell this thing anywhere you can, I'll give you 20%. That's a federal crime called capping. But there's an exception for this that somehow was written into the law. The story gets darker yet. These guys get compensated per milligram. In other words, at the end of the month, you can imagine an oncologist who gets a call from the drug rep, and the drug rep says, you're at 2,700 milligrams of this toxic chemo agent for the month. If you can get it up to 3,000, we're going to give you a bonus, 10%. Now, I don't know that this happens, but certainly there's the potential for it. So, I mean, the whole thing of pay per play is an outrage. And in theory, doctors working for health maintenance organizations don't have this particular conflict. They're not pushing every conceivable nonsense under the sun, but frequently they have the other conflict that they are incentivized to conserve resources and actually not treat by some sort of compensation package.
All right, let's take one step further. One step further is you go to see your doctor, your surgeon, and the surgeon says, you want to be a 38 triple Z times 2? I'm not going to do it. And the person's desperate and they leave the country and go somewhere else to get the work done. And then they come back and they're on the reality TV show trying to get that same doctor who wouldn't do the work to fix them. That seems like a whole scam.
You've got to realize that it's an arms race out there with boob size. And, so, and these women actually get something out of being distorted and too big because, the layman or their customers, their guys or whoever, I'm not saying they're hookers, but their ultimate customer is a husband generally. And these, many of us, and I'm talking about men now, we can't distinguish fake from reality. And in fact, the fake has become reality. It's become the accepted aesthetic. And so in California and in the United States, the boob size has progressively gotten larger over the years. And I don't know, I mean, I think the average when I was working was 450 cc's, which is, it's like 2 cup sizes bigger than whatever it was before. I mean, it's just crazy. So the question is how does the doctor possibly resolve these conflicts of interest? And I mean, you got to judge, the consumer has to judge us like plumbers. We're no different. We have to be, you have to try to develop a relationship, and you get referrals from a trusted source, preferably a doctor. And of course, ideally someone who's not getting paid for the referral, which is against the law, but it's still done in many cases in medicine. So, it's hard, and it's hard to overcome your own interest to make more money. But I mean, some of the plastic cosmetic guys are some of the best people in medicine because the ones that don't take insurance reimbursement are out of that financial system and all the insanity that's around that. But there are many, many, many frauds who are billing insurance for things that they don't do. I mean, for example, the nose surgeons they frequently bill for turbinate work when they're doing a cosmetic rhinoplasty, and so, I mean, there's all, the plastic surgeons can bill for hernia repair when they do an abdominoplasty, a tummy tuck, and the money is huge, especially if they own the surgery center. The surgery center charges are exponentially greater than the doctor charges, and the reason is the hospitals who influence the lobbying got surgery center charges jacked through the roof. So, I mean, sometimes these things, they can do an injection of something in a surgery center and do a surgery center charge of $20,000. The patient doesn't care. They don't pay. The copays frequently get written off, which is illegal. But Anyway, did I answer your question?
You did answer my question. I have so many more questions. This is fascinating. We have a show coming up right after this. So unfortunately, we have to say goodbye for now, but I hope you will come back and join me again.
There's a lot more, Jacqueline. We haven't
Yes.
gotten into the bad stuff.
Well,
So
as I
thank you
mentioned,
so much.
we have 20 shows a week, 25 sometimes. So I'd love to have you come back on some of our other shows as well. But I want to spotlight you. And if you can share with our audience how people can reach out to you, who you'd like to contact you, how they can get your books, that would be fabulous. And remember, we're also on the radio, so people cannot read the banners.
Okay, that's very kind of you, Jacqueline. So remember, my book names, they're all on Amazon. That's the easiest place to get it. These are $3 a piece. I'm not on Kindle. They're more in the print edition because it costs money to print them. It's Butchered by Healthcare and Hormone Secrets. And again, my name's Robert Yoho, Yoho. And my writing can be found on Substack at robertyoho.substack.com, and my website is robertyohoauthor.com. You can listen to my podcasts and so on. I can't imagine doing 20 of those things a week. You're a hero.
Well, thank you. We're going to 30 actually very soon. And as I mentioned, I'm excited to get your book. It's going to be here by tomorrow morning. They're delivering in the middle of the night now. It's said between 4 a.m. and 7 a.m. So
probably by drone.
Yeah, probably.
So,
exactly.
Right. So you're welcome to contact me anytime for questions. I can't give individual medical advice, but the whole thing is in the books.
Fantastic. Well, I will be reaching out to you. Hopefully you'll come back and see us again and we'll explore some other topics.
It's my pleasure, Jacqueline. Thank you.
Thank you. Have a great day. Bye. Thank you, everyone, whether you're watching us or listening to us, wherever you are in the world. We're so happy that you're here. Our next show is coming up. It's The Power of Etiquette and Manners. And my co-host, Philip Sykes, will be joining us from London. And we have a fabulous guest. So do stay tuned for that. Our shows are back to back today. The next one after that is Adversity to Awesome. And you can find our whole schedule over on our website, usaglobaltv.com. If you happen to be watching on YouTube, please go ahead and subscribe. A couple of quick announcements before we go. We have our special show coming up. It's our reunion show on Sunday. We'll be live streaming for 6 hours. And this show is all about promoting your business, your book, your event, your screenplay, your poem. We're actually sold out. So I hope that you will join us for that fabulous event. Also, in addition to being the founder and running USA Global TV, I'm also a certified life and career coach, certified meditation teacher, and certified yoga instructor. And I teach people how to listen. So our courses, The Power of Listening, help you have deeper connections, better relationships, and more authentic conversations. Please go over to my personal website, which is drjacalyn.com. All right, there are all the announcements I have for today. We'll be right back. Stay with us. We'll be back in less than 5 minutes. Bye for now. Bye, doctor.